I'm thinking, how much time do I have left? That's what I'm thinking, because there was no cure for it.
I thought he would die in his sleep, honestly. I thought I would wake up and my husband would be dead next to me. Yeah.
I kind of knew that we had to dig deep, and we did more tests, and I think we came to the realization that the time had come for Vernal to get a heart transplant.
There were no other options except heart transplant, because that's what is considered a cure for the disease.
Amyloid is a protein that we all have in our body, but when it deposits in the heart, it makes the heart very stiff, very thick, very restricted, and subsequently can't pump and send blood out to the body efficiently.
I was like, oh, okay. It wasn't a good thing,
It's very scary when you hear the news that there is a heart waiting for you. Most patients see their mortality at that time because they understand that a beating piece of their own body, their heart, is going to be removed from them and a new one's going to be put in.
The one thing that you think about, somebody had to die. And you're grateful to have a second chance, but somebody had to die.
But we thank him or her, or whoever it is, for their generosity, and we pray for their family. But that is hard. You got to take care of that heart.
How are you?
All right.
All right, so things look good. The heart looks good in the field, so we're gonna get you back into the operating room, get things moving along here, okay? All right, man, I got you.
Many years ago, one of our patients was gifted a disco ball from someone in her family, and she put it on her IV pole, and she would walk the unit trying to get her strength up for her heart transplant. After surgery, she passed it on to the next patient waiting for a heart in the ICU, and it became part of the ritual of a heart transplant.
All right. Love you.
Today we're doing Vernal's heart transplant. Right now we have one of our other surgeons, Dr. Hassanin's out in the field. He's assessed the heart and he's in the air bringing the heart back for transplant.
By Dr. Limmer for a orthotopic heart transplant on cardiopulmonary bypass under general anesthesia.
Let's do it. All right. Put the lungs down, please. Okay, Dr. Hassanin got back with the heart, so we're gonna put the clamp on and do the cardiectomy, okay? Okay, so right now we're cutting out the heart. We're opening the right atrium. We've already divided the aorta. Okay, here's the heart. Look at that thing. Ooh, big. Okay, 11 blade, please.
Sorry, sir.
All right, bring it up. Okay. I got a cold lap and it's nice. Okay, first stitch. All right, right now we're sewing in the left atrium. And now we're sewing the pulmonary artery in. The last step's gonna be to connect the aorta, and then we'll take the cross clamp off and see how the heart's working. Take off the clamp. Go ahead, pumps down. Everything looks pretty good. Heart's functioning well. All right, everything looks good.
Yes, Marie, that was an important call came in.
Yeah, I'm calling from the hospital right now. Great news. I just spoke with the doctor. He's all closed up, heart's in, and we're just waiting for him to come downstairs. So,
Did they fit it already?
yes.
I pray for you all the time, Marie, all the time.
Thank you.
And I thank God for you for being a good wife to my son. You don't know how it means to me.
Thank you.
I wasn't able to be there for my child, and you were there for him. It's a blessing. Thank you, Marie. Thank you, Pete, for taking care of my child for me. Thank you, thank you. I appreciate it. Thank you so much.
Thank you.
Show you his x-ray. It looks really good today. Progressing well.
Friday I got a heart. Now it's Monday. But I just know it's like a miracle, man.
It is.
It's like something
It is.
you don't know until you go through it. You can't explain it to somebody.
Yeah.
Okay.
So it's like a freak speak. Ow.
Yeah.
It's real now.
I could feel myself coming back
Coming out of the fog a little bit.
from what I had when you told me you knew this day was gonna come.
Yeah.
And now I feel totally different than that.
Now the day has come and passed, right?
Like, how many months you think it's gonna take for me to get out in public with my wife, you know? Go to a restaurant for like 3 months.
Probably earlier than that.
Okay, good. Okay. That's what I want to do, you know? Go to a nice restaurant with her for that first time. Cause she do a lot. Did you?
Happy to be here.
Are you a millionaire?
Yeah.
One of the things that is very unique here that we offer is that we allow our heart transplant patients to actually see their heart. It allows patients to have really nice closure and also understanding of why exactly they needed a heart transplant in a very physical, realistic thing that they can touch and feel and see.
Here's a normal heart. As you can see, we kind of say it's the size of our fist.
Right?
All right, and then now I'm going to show you yours, okay?
Wow.
Wow.
Oh my. Crazy. So don't touch it yet because you got to put on gloves.
Okay.
But as you can see, it's very large. And look at these walls. How thick. Very, very thick walls. And that's due to your amyloidosis. Just be careful with that, okay? Yeah, they can kind of fall apart.
That's really thick.
Yeah. Here's it.
Sorry the body had to work against you, but you did a good job. You see the normal heart, and you see my heart, and what it had to go through. It's a miracle it got me this far. Cause I was at the end, you know, and it just kept pumping. It wasn't going fast, but it kept pumping,
We stand here today to honor the miracle of organ donation and transplant. As a symbol, we would like to have you tie a ribbon on the tree of life and ring the bell. Congratulations on this valuable gift.
You know, to be where I was and where I'm at now, you saw the way I was before. Look, I have color in my face now. You know, I feel like I felt before I had the condition. I'm getting back to what I used to be. And you can't beat that. I'm blessed to be here.